So the opening panel today is about the hospital cuts and restructuring, what the consequences of those are. It's going to be co-chaired by myself and Dr. Ted Haynes. And Dr. Ted Haynes sits on our board of directors at the Ontario Health Coalition. He's a member of the Medical Reform Group. He lives in Hamilton and is a terrific advocate and does all kinds of other things that he's probably too modest to give to me for a bio. So I'm just going to start with outlining what are the cuts that we're talking about, what exactly is happening and why is it happening, and then we'll move on through the panel. The panel that's with us today is Dr. Ray Dawes, starting from the end, Kim Jarvie, he's the economist with the Registered Nurses Association of Ontario, Dr. Ray Dawes from the OMA, Ontario Medical Association, Section on Rural Practice, Dr. Joel Exton, who's an emergency room physician at the University Health Network and a professor at York University, Judith Wall, who's a lawyer with the Advocacy Center for the Elderly and the executive director of the Advocacy Center for the Elderly. And everyone is going to just give a short presentation, and then we're going to do questions and answers and discussion until noon. So what we're seeing right now across Ontario is a planned set of restructuring created by constraining hospital budgets, hospital global budgets, to a rate that is below the rate of inflation. So this year and next year, the provincial government has set hospital global budgets for a rate that's less than inflation. So what happens when you do that? You can't maintain existing services, right? There's a gap between your cost and your income, and therefore services have to be cut and restructured. And that is the goal of this particular set of budgeted levels for hospitals. In fact, the process to accomplish hospital restructuring and the restructuring powers were set up long before even the last provincial election. In the LHIN's legislation, the Local Health Integration Networks legislation. And yesterday we heard from lawyer Amanda Pask, who outlined for us in some detail what the powers were of the LHINs and the minister under the LHIN's legislation. If you want to look for that analysis, we'll put it up on our website, on the campaign part of our website, so it will be there. But in very short, the LHIN's legislation gives restructuring powers to the minister and to these local health integration networks. There are 14 local health integration networks across Ontario. So if you remember the Harris-era restructuring, the way that they did it was they set up a traveling restructuring commission, and they set up a plan for each community based on benchmark targets for bed numbers, and then they rolled out that plan from town to town. The government gave itself, some of you will remember, these extraordinary powers to order hospitals to close, merge or amalgamate, etc., transfer services in an omnibus bill. And that piece of legislation had a sunset clause, so the minister's powers to overturn or supersede the powers of local elected hospital boards were finite. They lasted for several years, and then they ended. In the LHIN's legislation, what they've done is, instead of having a traveling restructuring commission, they have standing LHINs in each community, and those LHINs and the minister have been given extraordinary powers to order what they're calling integration. Integration in the Act is defined as a whole raft of things that we would understand as integration, for example, coordination of services, but it also includes things like transferring services from one nonprofit provider to another nonprofit provider, mergers, dissolutions, closures of service, right? So it's restructuring powers. They're calling it integration, but really it's restructuring powers. The LHINs themselves are governed by accountability agreements with the province. These signed accountability agreements hold the LHINs to coming in within their allocated budgets. In turn, the LHINs require accountability agreements of the health service providers within their areas, including hospitals, and they have to come in within their designated budget, so no deficits are allowed. if a hospital board does not voluntarily sign the accountability agreement can be ordered by the LHIN, and that happened recently in Thunder Bay. The hospital board wouldn't sign the accountability agreement, so they received a directive from the LHIN to sign the accountability agreement. These powers are backed by fines in the legislation, so the hospital board members and CEOs can be fined for non-compliance. The provincial budget then, before the 2008 provincial budget, they set the levels of hospital funding at a declining rate of increase, less than the rate of inflation. So 2.4% for this fiscal year, which runs till the end of March 2009, and then 2.1% increase for the next fiscal year, which runs from April 2009 to the end of March 2010. And so that the inflation gap grows over each of those 2 years. And so the hospitals then are required to eliminate their deficits in the context of funding that is less than what is required, and that problem compounds over the next year. And so no surprise then, 50% of Ontario's hospitals have been or are in deficit this fiscal year. 70% of Ontario's hospitals are projected to be in deficit next fiscal year. And these deficits are not small. In a number of cases, they are very significant. And so the hospitals affected, that's hospitals of every size, small, medium, large, and teaching hospitals in every region of Ontario. And so just the scope of the deficits, the types of hospitals involved, lead to the conclusion that this is not a question of efficiency. This is a question of inadequate budgets, forcing through inadequate budgets, which then in turn force through restructuring, which I believe is the plan, but you can take what you want from that. Thank you. It is worth noting that Ontario's hospitals, by a significant number of benchmarks, are the most efficient in Canada. And I've provided you with a couple fact sheets in your kit, fact sheet number 2 and 3. One just sort of outlines the restructuring, and the second is summarizes the report of the Hay Group study on hospital efficiency. And basically what they find is that on measures such as length of stay, we have the shortest average length of stay in the country. We get patients in and out of hospitals quicker. We have lower rates of admission per capita. We have lower rates of staffing per capita. We have lower costs per capita. We fund Ontario's hospitals at a lower rate than the rest of the country, $100 approximately per person, which totals up to about $1.2 billion across the province when you look at it. And so now there's a fairly deep consensus that you can't cut hospital budgets without incurring serious cuts to clinical services. So in the short term, the budget deficits that we're looking at will require cuts to needed clinical services, medically necessary hospital services for patients, and downsizing of the workforce of about projected in the short term